Welcome to our deep dive into post-traumatic stress disorder, commonly known as PTSD. Now you hear that term thrown around a lot these days, but we're going to cut through the noise and get real about what it is, what causes it, and how to deal with it. We're talking about a serious condition that can turn your whole world upside down after you've experienced something traumatic. It's not about being weak or broken. It's about understanding the impact trauma has on your mind and your body. Today, we'll explore the causes, signs, diagnosis, and treatment options for PTSD. We're going to break it down in a way that's clear, understandable, and most importantly, helpful. Look, PTSD doesn't just come out of nowhere. It's not something that happens in a vacuum. It's triggered by something that shakes you to your core, something that disrupts your sense of normalcy, a traumatic event that leaves its mark on you, often in ways you can't immediately see. We're talking about things like violent encounters, life-threatening situations, or severe accidents. Anything that makes you feel deeply unsafe and terrified, shaking the very foundation of your being. And it's not just the big explosive events that can trigger PTSD. Sometimes it's the smaller, insidious experiences. Sometimes it's the emotional trauma that builds up over time, like a slow drip that eventually overflows. Like being in an abusive relationship or experiencing ongoing neglect, where the trauma is a constant presence. These experiences chip away at your sense of security and well-being, eroding your mental defenses, leaving you vulnerable to PTSD like a fortress with its walls slowly crumbling. Now here's the thing, not everyone who goes through a traumatic event develops PTSD. It's not a given, it's a complex interplay of factors including your personal history and resilience, and some folks are more susceptible than others, due to a variety of reasons. If you've got a history of mental health challenges like anxiety or depression, your risk increases. You might be more prone to developing PTSD after a trauma, as your mental reserves are already taxed. It's like your cup is already full, and any additional stress can make it overflow, tipping you over the edge. And let's not forget about the importance of support. It's a crucial factor in how we cope. If you've got a strong network of family and friends, people who truly care about you, people you can lean on and confide in, you're more likely to bounce back from trauma. This support acts as a buffer, helping you process and heal from the traumatic experience. You're more likely to bounce back from trauma, finding your way back to a sense of normalcy. But if you're facing it alone, without that crucial support, the isolation can make the road to recovery much tougher, feeling like an uphill battle. We also gotta talk about the role of genetics. It's an important piece of the puzzle. Some folks are just wired differently, and they may have a genetic predisposition to PTSD. It's like inheriting a sensitivity to stress and trauma, making them more vulnerable. And then there's the impact of ongoing stress. Chronic stress can wear you down over time. If you're constantly under pressure, dealing with financial worries, relationship problems, or job insecurity, your ability to cope with additional trauma is compromised, making it harder to bounce back. It's like your resilience reserves are depleted, leaving you more susceptible to PTSD, as your mental and emotional resources are stretched thin. PTSD can manifest in so many different ways, but there are some common signs and symptoms that should raise a red flag. We're talking about changes in your thoughts, feelings, and behaviors that interfere with your daily life. These changes can be subtle at first, but over time, they can become more pronounced and harder to ignore. One of the hallmark symptoms is intrusive thoughts, those unwanted memories, nightmares, or flashbacks that transport you right back to the traumatic event. These can be incredibly vivid and distressing, making it feel like you're reliving the trauma all over again. It's like your mind is stuck on replay, and you can't escape the images, sounds, and feelings of that moment. This can lead to a constant state of anxiety and fear, making it difficult to focus on anything else. Avoidance is another big one. You might find yourself going out of your way to avoid anything that reminds you of the trauma. You might start avoiding places, people, or activities that remind you of the trauma. This can severely limit your daily activities and social interactions, leading to feelings of isolation and loneliness. It's a way to protect yourself from those painful memories, but it can also keep you stuck in a cycle of fear and isolation. Over time, this avoidance can make it harder to confront and process the trauma. PTSD can also mess with your mood and your thinking. You might find yourself feeling more irritable, anxious, or depressed than usual. You might feel emotionally numb, detached from others, or lose interest in things you used to enjoy. This emotional numbness can make it difficult to connect with others and enjoy life. It's like the world has lost its color, and nothing seems to matter anymore. This can lead to a sense of hopelessness and despair, and then there's the hyperarousal and reactivity. This means you're constantly on high alert, as if danger is lurking around every corner. You're constantly on edge, easily startled and quick to anger. This heightened state of arousal can make it difficult to relax and can lead to problems with sleep and concentration. It's like your fight or flight response is stuck in overdrive, and you're bracing yourself for danger at every turn. This can be exhausting and can take a toll on your physical and mental health. These are just some of the common signs and symptoms of PTSD. It's important to recognize these signs early and seek help. It's important to remember that everyone experiences this condition differently. There's no one-size-fits-all presentation. Each person's experience with PTSD is unique, and their symptoms can vary widely. You might struggle with sleep disturbances, difficulty concentrating, or experience physical symptoms like headaches, stomach aches, or muscle tension. These physical symptoms can be just as debilitating as the emotional ones. It's your body's way of telling you that something's not right. These symptoms are a signal that you need to take care of yourself and seek help. If you're noticing these red flags in yourself or someone you care about, it's crucial to reach out for professional help. There are many resources available to help you manage and overcome PTSD. Don't wait for things to get worse. The sooner you seek help, the better your chances of recovery. Early intervention is key to getting back on track. With the right support and treatment, you can start to heal and regain control of your life. Now let's talk about how PTSD is actually diagnosed. This is where a mental health professional comes in, someone who's trained to recognize the signs and symptoms and make an accurate assessment. The gold standard for diagnosing PTSD is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5 for short. It's like the Bible for mental health professionals, outlining the specific criteria that must be met for a PTSD diagnosis. First and foremost, you gotta have been exposed to a traumatic event, either directly experiencing it, witnessing it firsthand, or learning about a traumatic event that happened to someone close to you. And it's not enough to just experience the trauma. You gotta have specific symptoms that last for more than a month and interfere with your ability to function in your daily life. These symptoms fall into 4 main categories: intrusion, avoidance, negative changes in mood and thinking, and hyperarousal. The mental health professional will also assess the severity of your symptoms and how much they're impacting your work, your relationships, and your overall quality of life. They'll want to rule out any other possible explanations for your symptoms, like medical conditions or substance abuse. To get a clearer picture, they might use assessment tools like the PTSD checklist, PCL-5, or the Clinician-Administered PTSD Scale, CAPS. These are questionnaires that help measure the severity of your PTSD symptoms. Getting a proper diagnosis is crucial because it's the first step towards getting the right treatment and support. It's about understanding what you're dealing with and empowering yourself to take control of your recovery. Now here's the good news: PTSD is treatable. With the right approach and support, individuals can find relief from their symptoms and lead fulfilling lives. There are effective strategies and therapies that can help you manage your symptoms, regain control of your life, and move forward with strength and resilience. It's important to remember that seeking help is a sign of strength, not weakness. Treatment for PTSD is not a one-size-fits-all approach. Each person's experience with PTSD is unique, and so should be their treatment plan. It's about finding the right combination of therapies, medications, and lifestyle changes that work best for you. This personalized approach ensures that you receive the most effective care tailored to your specific needs. One of the most effective treatments for PTSD is psychotherapy, also known as talk therapy. This form of therapy allows individuals to explore their thoughts and feelings in a safe environment. It provides a safe and supportive space for you to process your trauma, challenge negative thoughts and beliefs, and develop healthy coping mechanisms. The therapeutic relationship itself can be a source of healing and support. There are different types of psychotherapy that have been proven effective for PTSD, such as cognitive behavioral therapy, CBT, exposure therapy, which helps you face and reduce the power of your trauma-related memories, eye movement, desensitization and reprocessing, EMDR, and group therapy. Each of these therapies offers unique techniques to help you heal. Each approach has its own unique techniques and benefits. It's about finding what resonates with you and helps you the most. In addition to therapy, medication can also play a role in managing PTSD symptoms. Medications can help stabilize mood and reduce anxiety, making it easier to engage in therapy. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed to help manage symptoms, and serotonin norepinephrine reuptake inhibitors, SNRIs, which can also be effective in treating PTSD. These medications can help alleviate symptoms of depression, anxiety, and intrusive thoughts, making daily life more manageable. Another medication that's showing promise for PTSD is prazosin. Originally used to treat high blood pressure, it's actually a blood pressure medication, but it's been found to reduce nightmares and improve sleep quality in people with PTSD. Better sleep can significantly improve overall well-being, but treatment goes beyond therapy and medication. A holistic approach can be very beneficial. It's also about making lifestyle changes that support your overall well-being. Eating a balanced diet, staying hydrated, and getting enough rest are all crucial. Regular exercise, for example, has been shown to reduce stress, improve sleep, and boost mood, all of which can be beneficial for managing PTSD symptoms. Physical activity can be a powerful tool in your recovery. Mindfulness practices such as meditation and deep breathing exercises can help you stay grounded in the present moment and manage overwhelming emotions. These practices can be easily incorporated into your daily routine, can help you stay grounded in the present moment and manage overwhelming emotions. They can be particularly helpful during moments of high stress or anxiety, and don't underestimate the power of a strong support system. Having people you can rely on can make a significant difference. Connecting with loved ones, joining support groups, or even finding a community of people who understand what you're going through can provide immense comfort and encouragement. Or engaging in activities that bring you joy can make a world of difference in your recovery journey. Finding joy and purpose in everyday activities can be incredibly healing. Listen, if you or someone you know is struggling with PTSD, please know that you're not alone. This is a common condition that affects millions of people, and there is absolutely no shame in seeking help. In fact, it's a sign of strength and courage. Early intervention can make a significant difference in your recovery journey. The sooner you reach out for support, the sooner you can start healing and reclaiming your life. Remember, PTSD is treatable, and there is hope for a brighter future. Take care of yourself and don't hesitate to seek the help you deserve. If you or someone you know is struggling with PTSD, it's important to seek help. Early intervention can make a significant difference. Thank you for watching and take care.